I'm Tom Morrison. Welcome to another edition of MTI TV. As everyone knows, the Affordable Care Act takes effect on January 1, and if you're like any other business owner, I'm sure you still have tons of questions. Over the past few weeks, there have been numerous changes to how the law is being implemented due to the exchanges not performing as promised, premiums rising, and cancellation of policies. As your industry trade association, we want to make sure we're giving you the key information for you to make sound decisions in the area of your business. Today, we're going to focus on what we should be acting on when it comes to health care. Today, we have with us Tim Owen, president of Owen Associates, one of MTI's industry support partners in the area of health care. Tim has been very active on the state and national level with the whole health care debate, and we're glad to have him with us today to share his perspective on how this ever-changing health care landscape is going to shake out. Tim, welcome to MTI TV.
Good morning, Tom. Good morning, MTI members. Thanks for having me here today. I hope you don't mind me being a little casual today. I'm up in my Georgia office in a beautiful area called Pine Mountain, Georgia. How can I help you today?
Tim, the law passed. We're now just a couple weeks away from the January 1 date of it officially going into effect. Tell us what is happening right now.
Well, that is the $64 question. Obviously, the latest news is President Obama says that you can keep your current plan. Now, what does that really mean? Well, let's basically talk the small group market for a moment. Small group in most states in the country includes 49 employees and down. There are two platforms. There are a group platform using the old composite rating, employee, employee child, employee spouse, employee family. But the new platform does not have composite rating. So if you go to a new plan, not only are you going to pay a 40 to 60% rate increase if you're a small group, you're also going to lose that composite rating. You no longer will just have 3 tiers or 4 tiers of rates. Each person in your group, based upon their age, is going to have a different rate. They're also going to be using the new age band that went from a 5-to-1 ratio to a 3-to-1 ratio. And what that means basically is that older enrollees are going to pay less. If you're 55 or older, you're going to pay less. But if you're 18, 20, 30 years old, you're going to pay more. So again, we recommend that if you have a January effective date, you should try to renew early. I will almost guarantee you that you'll save at least 50% if you renew early, or at least that's what you should save. Now, another nice thing about renewing early and staying on that old composite platform, but keeping your old plan, is most carriers not only will allow you to keep your own plan, but they also will give you options on that old platform. So if there's any way that you can keep your old plan, I highly, highly recommend that. Another trend we're seeing in the small group market, a huge trend, in fact, we even did it ourselves, is the small groups of 49 employees or less, they're dismantling. We honestly feel like that's going to be a trend in the future for those people who can't renew early. Basically, here's what we did. We took our small group, and again, small group is 49 employees and below, and dismantled the group plan. We did away with it. We gave all of the employees a raise, and in many cases, if employees are lower paid between $16,000 and say $30,000 a year, they qualify for a subsidy. So they're kind of holding the raise in one hand, the subsidy in the other, and they put the two together, and the net cost for health insurance, $20, $30, $40, $50 a month for the employee, plus they're getting better plans. So you no longer have increases of premium. We saved almost on average $200 per employee based upon our current rates, not our renewal rates, our current rates. We saved that much. And the employees picked their own carriers, they picked their own plans, they had more choices. And frankly, we're done with it. We're done with the headaches of renewal. We're done with the headaches of group insurance. Everybody has an individual plan. It worked out fantastic. We dismantled our group plan. So that's going to be, we think, a huge trend of what you're going to see in the future. So renew early, keep your old plan if you're going to stay group, and consider taking a look at individual plans. If you have an exchange open in your state and it's not a federally run exchange, I would get some exchange quotes. Another trend we're seeing is that the small employers, and this is important, if you have 25 or less employees and an average of $50,000 salary, that doesn't include stock dividend payments, a $50,000 average salary, you could possibly qualify for a 50% credit, not a write-off, but a credit off of your health insurance premiums. So if you got a credit for 50% of your health insurance premiums and you're 25 employees or less, averaging 50,000 or less salary, that could be a really good option for everyone as well. I do want to say this, individual policies have gone up, the prices have gone up radically. However, they're still lower than group plans, which is again why we're recommending the potential, or at least looking at the option of dismantling.
What has caused all the confusion with the implementation of the Affordable Care Act?
Well, there is a lot of confusion. Typically, it has come from only two areas. One is just you're not aware of health care reform. You don't know the details. You don't understand the penalties. You don't know the implications or the effects of health care reform. So I recommend occasionally attending a WebEx. In fact, we'll be holding a WebEx, which I highly recommend that everyone attends. This is the most current, the most relevant, the most up-to-date, and extremely accurate information. So consider doing that and kind of finding a good source and sticking with that source and check in frequently. But the biggest confusion really lately has come from technology. What happened with healthcare reform and the exchanges is what they should have done, frankly, is they should have plugged into one of the two largest quoting engines in the country. We use one. We use Quote-it. The other quoting engine out there is eHealth. They already quote millions of people. In fact, the websites were already built. They could give you the quotes, and then they should have handled the subsidies somewhere else. They should have done it another way. So when they tried to tie in Homeland Security, the IRS, the Department of Labor, the Centers of Medicare, Medicaid, those systems aren't even the same computer systems. So what they tried to do is connect all of those together. The moment they asked for a social security number, that's where the complication from a technological standpoint existed. Until they get that fixed and they can seamlessly connect those computer systems together, which I have no idea how they'll do that, you're going to remain confused and it's going to remain down. If they would have the quoting engine on the left and the subsidies on the right, I think that the confusion would go away and the technology would get up and running. Where we are disabled right now and in the individual market, we're doing a ton of individual business, is in the market where people need a subsidy, because we need those federal exchanges working in order to calculate those federal subsidies. And right now, the people wanting subsidies have no idea, can they get them? How much will they be? And how do they apply for them? Because from a technological standpoint, they can't apply electronically.
It looks like we should see some more delays in certain provisions of the ACA related to the phrase, if you like your policy, you'll get to keep your policy. What is going on with that right now?
Well, actually, if someone keeps their old policy, honestly, it really won't delay anything. In fact, we were shocked at how fast carriers responded to that comment that President Obama said you can keep your old policy. Carriers pretty quickly said, okay, we'll allow you to keep your old policy. And then it created two platforms, as I mentioned earlier. But the bigger issue about keeping your old policy is what is the impact of future rates. And I want to kind of show you a visual that really demonstrates what's taking place, what's going to drive your rates, and what's going to impact your future rates. Let me show you that real quick. Take a look at the visual that I have here. The things that are going to impact our rates the most for the biggest item is going to be new procedures and surgeries that people want to have because pre-existing conditions are covered. This is going to have the largest impact on future rates because there are a lot of people sitting out there right now that want to get something done, and they just can't wait to get their health insurance to get that procedure or surgery done. Also, another big impact is the type of plan people are going to choose. If they choose a bronze plan, it's going to have lower claims, therefore lower future premiums. If they pick a platinum plan, it's going to have higher claims, and it's going to impact the rates even higher in the future. Also, I don't know if you know this, but the enhanced benefits, what is called the essential health benefits for all of the new plans, include things like pediatric health insurance, but it includes dental and vision. It's never included such a thing. Also, new drugs, new surgeries are going to be included in those enhanced benefits, and all of that's going to make the premiums go up even more. Plus, you're going to see the blending of genders and ages. No longer will there'll be male-female policies. They're all going to be unisex. The claims of a group are going to be based on the state claims, the community, and the community is the state. And then they have a new age band rating. The older people are going to pay a little more. The older people are going to pay a little less, and the younger people are going to pay a little bit more. So the way health insurance is going to be rated and priced in the future is going to have a radical big impact on future cost. Now, let's talk about the statement that President Obama said when he said you could keep your old plan. The issue with that is it took one risk pool. Imagine everyone swimming in a swimming pool and they all have the same plan, or at least the same pricing platform. And the moment he said you can keep your old plan, what he basically did when he said this was we're going to split the risk pool. Now, he's not an underwriter, but anytime you split a risk pool, you now have two groups of people. The question is which risk pool will do better than the other one. We think that the risk pool in the new plan is actually going to do worse, to be very candid about it, because it has new benefits, new pricing structures. The loss ratio on that risk pool is probably going to be worse. So in a way, this decision, and I think it's an unintentional consequence, is going to be a good one, but I want you to be clear on this. It's only going to last for a month or so. Once that risk pool begins to age and more new groups change plans, change companies, and go into these new ACA plans, which people are going to do, and the insurance companies don't want two risk pools. They're going to force people from this old risk pool, and they're going to, at the renewal, they're going to push them into the new risk pool. So honestly, they'll probably blend the two together. They're going to do whatever is most profitable for an insurance company. But it complicated things, and the administration of two risk pools could raise cost. But temporarily, I think people staying in that old plan, the gray section of that pie chart, could lower rates for a little while, even for the new plans.
So what should business owners be asking their local healthcare agents, or what steps should they be taking in the coming weeks?
Tom, that is a very good question. First of all, let me say this. I'm not being rude. I'm just being candid about it. If your agent is not bringing these 6 thoughts or strategies to you, frankly, I think you need a new agent, or you should call us and let us be your agent. But if I can be so bold to say that. But here are the strategies, 6 things you need to be doing. Number 1, as I mentioned earlier, there are 2 platforms. There's the pricing of the composite rates, employee, child, employee, spouse. Get rates and quotes on that platform, but also get rates on the new platform. It's a little more complicated. You're not going to see composite rates. You're going to see age-banded rates when you compare the new and old plans together, but you need to compare them because the carriers may even start pushing people into the new plans, and they might price those more competitively. Strategy number 2 is always compare individual plans to the group plans. As I mentioned to you earlier, Owen Associates did that. We did away with our group plan. Why? Because the individual plans were about $200 less per person, and that was compared to our current rates. Strategy number 3, consider if you do go individual, remember that there's bronze, silver, gold, and platinum plans out there. Consider using bronze plans plus a supplement like an Aflac type product or Aflac products. We did. And you can buy a bronze plan plus an Aflac plan and have a platinum outcome at a bronze price, which is a very good strategy. Number 4, you've heard me mention dismantling. Consider giving your employees a raise. Now, this is important. Give them a raise based upon what their premiums are going to be. So a 60-year-old premium might be $350. A 20-year-old premium might be $220. Well, you don't want to give everybody a $300 pay raise across the board. I think those pay raises should be equivalent to what their premiums are. You give them a one-time pay raise, you've locked in your employer contribution, and frankly, you're done with group insurance, and let the employees have more plans, more options, and lower cost on the marketplace or through individual policies. Again, if they qualify for a subsidy, they're holding that raise in one hand, the subsidy in the other, and this strategy number 4 could equal the lowest net cost for all your employees. Strategy 5, always quote individual plans for your spouse and children. Your agent should be doing that for you. Why? Because those spouse and children rates are lower and they cost less than group plans. So make sure you're helping out your spouses and your children in getting those kind of options. Strategy 6, which is sort of a culmination of what you ought to be doing. You can continue shopping as you do now. These are your 3 options, but I don't recommend it because rates are going to keep going up, and when rates go up, so do your employer contributions. Number 2, if you have a small group plan and you have 25 employees and they're averaging $50,000 salary or less, the old number was 25% credit. That has been raised. Now you can get a 50% credit of your annual premium if you have 25 employees with an average of $50,000 salary or less. So you should be looking at rates from the Small Employer Health Option Program. By the way, as of today, the exchanges, more and more of them are online. Subsidies are being calculated, so know that that's happening. Technology is sort of coming together slowly but surely. Also, last, I keep mentioning dismantling because it does offer lowest cost, most choices, no headaches. It's a worthwhile option for you to be quoting or your agent to be quoting for you. I hope this helps.
Tim, it sure is a crazy marketplace, and we appreciate you taking the time to help clarify some of that craziness. Thanks for being with us today on MTI TV.
Tom, everyone at MTI, if you need some help, call us. And we're always here to help you. You don't have to change agents to use us, but we're always here at your service, and thanks for having me today.
Members, who knows where healthcare is going to be in the next 12 months? The key is staying on top of the latest information and solutions that allow you to continue quality health benefits while minimizing your costs. Make sure you're partnering in with a team who isn't just watching premiums, but are studying the changing legislative landscape and how it will impact your company's profits. At MTI, we're partnered with an industry support team that helps provide members the information you need to make solid decisions. If you're not happy with how your local health insurance professional is handling your employee benefits, contact the MTI office and we'll direct you to Owen Associates to manage your future healthcare costs. Remember, there is strong and then there's MTI strong. I'm Tom Morrison. See you next time on MTI TV.